Good morning to everyone. Myself, Dr. T. Arun Kumar, Department of Chemistry, SNS of Technology, Coimbatore. Today, we are going to see about the case study on urinary tract infections. Patient information: name Jani Doe, age 30 years, gender female, occupation office manager, medical history, no known chronic illness, no history of kidney or urinary tract problems. Present complaint: John Doe presented to the primary care clinic with complaints of a burning sensation while urinating, increased frequency of urination, and lower abdominal discomfort. She mentioned that the symptoms started around 2 days ago and have been progressively worsening. Clinical assessment. Upon examination, the following findings were noted. First, we noted the temperature, heart rate, blood pressure, lower abdominal palpation. We checked. Then we checked by using the finger. We checked whether we having a pain or not. Then we send the sample to the urinary analyze. So that according to this, when we check the temperature, it shows 99.5 degree Fahrenheit, that is 37.5 degrees Celsius. There is no issue. And heart rate 80 beats per minute is a normal heart rate. Then blood pressure 120 per 80 mm mercury level. So it is also normal because it comes under only 120 per 80. So lower abdominal tenderness, upper palpitation. Now when we seeing that palpitation is occurring, then no flank pain or CVA tenderness. Then urine analysis revealed the presence of leukocytes, nitrites, and bacteria in the urine. So when we checking the lower abdomen pain, we having a palpitation. So it indicates that we having any identification that whether he having urinary tract infection or not. When we checking the urine analysis revealed the presence of leukocyte and nitrates indicates that, and bacteria indicates that some problem in the urination. The diagnostics and differential diagnosis. Based on the clinical presentation and urine analysis result, John Joy was diagnosed with a urinary tract infection, that is UTI. The presence of leukocyte and nitrites in the urine, along with her symptoms, strong indicated a bacterial infection in the urinary tract infection. At last, by seeing the differential diagnostics, it indicates that he having that problem of urinary tract infection. Then differential diagnostics. Other possible diagnostics that could present with similar symptoms include interstitial cystitis. This condition can mimic UTI symptoms, but it is not associated with the bacterial infection. He is clearly indicating that if cyst is present also, we're not able to say that whether he having a urinary tract infection or not, because it won't indicate any bacterial infection. Then pyelonephritis, an infection of the kidney that can present with fever, flank pain, and urinary symptoms. Then urethritis, inflammation of the urethra can cause similar symptoms, but it may not also involve the bladder. Treatment: John Doe was prescribed a course of antibiotics, example ciprofloxacin, that target the bacterial infection causing antibiotics, maintaining good hydration and practice proper hygiene. Additionally, she was recommended to avoid irritants like caffeine, alcohol, and spicy food that might exacerbate her symptoms. Follow up: John Doe was instructed to follow up in 1 week to assess her response to treatment. She has also advised to return earlier if her symptoms worsened or if she developed any new concerning symptoms such as fever, severe pain, or blood in urine. Outcome: after completing the antibiotics course, John Doy's symptoms gradually improved over the next few days. She attended her follow-up appointment and reported no allergic symptoms. Her urinalysis showed no significant abnormalities, indicating successful resolution of the UTI, that is urinary tract infection. Education points: urinary tract infections are common bacterial infection that primarily affect the urine system. Risk factors of UTIs include female gender, sexual activity, improper hygiene, and urine retention. The proper diagnosis involves clinical assessment and urine analysis. The treatment typically involves antibiotics and its importance to complete the full course to prevent recurrence and antibiotic resistance. Hydration, hygiene, and avoiding irritants are key aspects of prevention. Thank you.